Welcome to our Galway Clinic Ortho Info Patient Information Series, being delivered to you by the Galway Clinic in partnership with Professor Cathal Moran. Cathal is a well-known consultant orthopaedic surgeon, Professor of Orthopaedic and Sports Medicine, and a specialist in the management of pain and injury of the shoulder and knee. Cathal, delighted to be here with you today, and thank you for joining us for this discussion on rotator cuff tears.
Nice to be here, Claire. Always nice to catch up and chat about orthopaedics and sports medicine, and of course help the patients however we can.
Cathal, we receive a lot of phone calls in the Galway Clinic from patients who have been told by either their physiotherapist or a GP that they have a rotator cuff tear. What exactly is a rotator cuff tear?
Okay. Well, I suppose the rotator cuff is a group of tendons or muscles around the shoulder joint which plays a key role in keeping this ball, the ball and socket of the shoulder joint together. It plays a key role in movement of the joint, but also in stability of the joint. It can be, however, prone to a lot of wear and tear over a lifetime. Essentially, every time the arm moves or the arm is lifted out, one can pinch what we call the upper rotator cuff or supraspinatus region of the shoulder between the shoulder cap, the acromion, and the top of the arm bone. That can create a little wear and tear in the tendons and so on, and can create an issue where it can go on to be pinched, inflamed, or even torn or partially torn. Sometimes patients even go on to have full-blown tears where they have a fall or an injury and the actual rotator cuff can become torn, which creates typically a lot of pain for a patient or indeed a lot of issues with movement.
Carl, how might a patient know if they have torn the rotator cuff?
Well, I suppose if we go back to it initially, patients don't typically present, although maybe nowadays with MRI scans and so on, the diagnosis might become known early in the process, or at least a presumed diagnosis. But if I take it back a step, I suppose what we look typically are for what we call symptoms or signs. Symptoms are either where a person might have pain or reduced movement and so on, or a pinch or pain on it when lying on the shoulder and so on. Classically then, they might have some issues with movement or with full strength of the shoulder. And when we assess it, be it as a physiotherapist in the office, the GP, or in a specialty office such as myself, we can test these various factors out. I think one of the issues that we see a lot of now is that there's a lot of tendency to do early MRI scans. And MRI scans in most people over a lifetime will show a little wear and tear. Classically, I will use the MRI to reassure the patient that they don't have a major injury, rather than necessarily focusing on that wear and tear, that little tear that might be mentioned on the report. I think it's important that we put the symptoms the patient have in contact with their examination and chat about together what we feel is really driving their pain.
Carl, can a rotator cuff injury heal by itself, or will it need a surgical intervention?
Well, as I say, they're very common. We say 60 or 70 people in the 60 to 70-year-old group will typically have some form of rotator cuff tearing, wear, and so on. And obviously over a lifetime we see those frequently. Even if you scanned you and I, we might see a little wear and tear within the cuff. So by no means does everybody need surgery. I've seen patients in my office with what we call large rotator or massive cuff tears with still good movement and very little pain. And equally, I've seen some patients with what appear to be small problems or small tears and being quite a bit of difficulty. I mean, we do tend to move towards early treatment or early repair and reconstruction of fit or healthy young people who have tears as a result of a fall or injury. But in many cases, we can treat without actually going early to surgery. Typically, we might engage the help of a chartered physiotherapist, a personal trainer, or certainly a structured exercise program in the early stages. Alongside that, we might use therapies such as anti-inflammatories or paracetamol for pain. We might recommend an injection to the shoulder joint to give a window of opportunity where the pain might be reduced and exercise might be used. But classically what I'm getting at is, I suppose, the fact that we like to move toward the least invasive options first. In my hands, I classically might move towards a surgical procedure. Yes, when I suppose the symptoms and signs tie in with what the X-ray and MRI might show, and when that patient really feels they've exhausted the other options and they're ready to take on the practicalities of the surgical procedure. But by no means is everybody moved quickly towards surgery. The idea is to treat most in a non-operative way if we can.
Carl, a lot of patients might feel that exercise will exaggerate the injury. Is this true?
It certainly can. In the early stages, I do see a lot of patients who come forward with a situation where they feel that they're worried that exercise might make it worse. And certainly after an acute event with a big injury, it's appropriate to have it assessed. But where we feel a condition and one comes on gradually and where one mightn't recall a specific event, but more it's a wear and tear phenomenon that might have happened over a lifetime, be it through their job or their work or an old injury in the past, Classically, we will go to exercise early on, but I think it's useful to have it assessed by either a physiotherapist or someone like myself in the early stages to guide that process and to put the patients along the route. Classically, as I say, I like to patients, even if they've tried that before coming to see me, a lot of patients find that very helpful.
Cathal, what should a patient do if they've been told they have a rotator cuff injury?
As I say, classically having it assessed by the physiotherapist, starting off with gentle exercise and so on. But we've two groups, as I say. That first group where it's a wear and tear phenomenon, gradual onset over a lifetime. But secondly, we have always, I suppose, we do see a lot of athletes, a lot of sports players and so on, or even people in all walks of life who might have a fall, might develop sudden weakness of the shoulder, feel a pop or a tear. In that type of scenario, it is important to come forward for early assessment and treatment. That's not one to be put on the long finger.
At what stage during the patient journey should they come and seek advice from a specialist like yourself?
Well, I think again, it's once they've tried those early non-operative options. By all means, we're happy to see them in the early stages if they feel it's appropriate or if they feel the need of reinsurance. But most conditions are responsive to those non-operative options that I mentioned earlier. And really, in most cases, we encourage that. But by all means, if patients are more reassured by coming for the chat first, we'll help out however we can.
Cathal, thank you so much for joining us here today and for your expert advice on rotator cuff injuries. As always, it's a pleasure to speak with you.
Delighted to chat, Claire, and help anytime.
Today's Ortho Info Patient Information Series has been brought to you by the Galway Clinic in partnership with Professor Cathal Moran. For a consultation with Cathal and treatment at the Galway Clinic, please see our contact details shown here.